Welcome back. I'm now joined by Dr. Rollins and Meredith. Thank you both for coming in. And what are we talking about today, Dr. Rollins?
We're going to talk a little bit about a special injection that's been pretty hot the last year or so we've been using to facilitate weight loss in a lot of our patients. And everybody out there has probably heard of B12 and B12 shots. That's a fairly common thing. B12 is a very important vitamin for metabolism and for energy. So if you are low in B12 especially, you can really have troubles with your metabolism and fatigue for a lot of people. But the specialty of this injection that we use is actually some other components called MIC, M-I-C, methionine, inositol, and choline. But suffice it to say that these other elements are an amino acid and a B vitamin and another nutrient that helps break down fats. It helps the liver to actually metabolize and break down fats. And it's good for cholesterol and detox and some other things. But it's been pretty hot for weight loss, and we've been incorporating it into some of our programs for a better part of the last year. I've been really impressed with it. So I thought we'd share it today. And Meredith is our nutrition and wellness consultant in the office, so she gets the pleasure of dealing with the patients the most who have had the success stories with it. So other than giving you the shot, I thought we'd better let her talk about it.
I think that's better, So, I don't, I'm not prepared for it.
Maybe you can share some examples. Maybe Meredith can share some examples of what she's seen here just in the last week or so with some of our patients doing this.
Absolutely. People are always coming back to get this shot again. A lot of times we'll just do one with them and say, tell us how you feel at the end of the week. Energy's improved. I had a gal come back after 4 weeks of being on the shot, and she had lost 8 pounds without changing anything else. And that's not a typical result. But definitely the energy is the sense of well-being, and there's even the added bonus of thyroid regulation as well. So.
Awesome. So other benefits as well.
Okay.
And how often would one typically get the B12 shot or this shot?
It's self-administered, so you can do it every 2 to 7 days. And a lot of times you'll need it more at the start, and then you can kind of taper off after you've been on it for a little while.
Okay, awesome. What's the what do you think is the regulated stance, I guess, once you should maybe stop using it at a certain point? Is that just kind of personal reason, or like personal preference?
Usually people will do it for several months. There's no harm in doing it longer. It may be more than necessary. You'll find some of these same supplements in oral forms, but the advantage of the injection is you just get much better blood levels in general, whether it's IV. This happens to be subcutaneous, which is a lot like an insulin shot, so it's easy peasy for patients to do at home. So if people are needle phobic, we show them how to do it. We'll have to get you over that next time.
That's okay. All right. Well, thank you both for coming in and explaining the B12 shot.
So if you want to learn more about it, we have our free seminar coming up here next Monday night, the integrative weight loss, and we'll talk more about this and other methods that we use for weight loss. At 6 p.m. at the Integrative Medicine Center.
Awesome. Thanks. We'll be right back.